Hello, hello. This is Dr. Terry, and I'm just checking in for Tuesday's talking points. And one of the things that's on my mind today is that this is National CMV Awareness Month. So many people are talking about men's health awareness, as we should. But in my field as a neonatologist, one of the things I'm concerned about is increasing awareness for CMV, or cytomegalovirus. So June is actually Cytomegalovirus Awareness Month. And if you've been following my page on Dr. Terry MD, you've seen a lot of posts that had to do with CMV. And you've probably wondered, why is Dr. Terry talking about CMV? Like, why does she keep talking about CMV? CMV is one of the most common viral infections that we don't even know we have. Did you know that over 70 to 80% of individuals have been exposed to CMV, cytomegalovirus? Most women who are of childbearing age, 70 to 80% of women are actually CMV positive. When you have a CMV infection, if you have a normal immune system, it looks no different to you than a cold would. So you wouldn't necessarily know that you had CMV. And CMV is passed the way most viruses are passed, basically through our body secretions. So through the runny nose, through blood, through body secretions. So the best way to prevent CMV is what we always say, just really, really strict hand washing and making sure we do good hygiene care there. But the reason I'm really concerned about CMV is because CMV can be a significant cause of birth defects in the neonatal ICU nursery. And so because it's so common, particularly if you're exposed to it in the first few months of pregnancy, it can lead to very significant birth defects, like having a baby that's born too small, having a baby whose head is smaller than it should be because the brain has not grown the way that we would like it to grow, having a baby whose clotting cells, which are your platelets, those are the red blood cells that help you to clot. Your platelets are lower than they should be, so you can have more bleeding. So for us, anytime we're in the nursery, if we have a baby that's smaller than they're supposed to be, or especially if we have a baby whose platelets are low, we will check for CMV. And unfortunately, there's no way to really cure CMV, but there are medicines we can do to try to treat CMV to prevent long-term effects, but it doesn't really cure the effects of the exposure with respect to being CMV positive. Some of the long-term effects for babies in the ICU nursery that have been exposed to CMV include deafness, so it's a very common cause of deafness, as well as developmental delay, and that's the main reason why we treat babies really is because of the risk for deafness. So those are my Tuesday talking points, and so if you've been wondering why I keep tweeting all month about CMV, or why I keep posting all month about CMV, is because 70 to 80% of women of childbearing age have been exposed to CMV and didn't even know it. And it can have significant effects long-term on the baby during development as well as after delivery. So I hope that you guys found that helpful. You guys be safe out there. Thanks so much and have a good one. Bye-bye.